this video, we will be doing a subxiphoid cardiac scan. Depending on the size of the subxiphoid space, either a phased array cardiac transducer or a curvilinear abdominal transducer can be used. The scan is obtained by placing the transducer in the subxiphoid space. Note the position of the hand over the top of the transducer is imperative in order to be able to tilt the transducer sufficiently to view the heart. Depending on patient habitus, the depth setting should be somewhere between 20 and 30 centimeters. The transducer should initially be aimed towards the midline of the sternum and then gradually rocked to the left edge of the sternum. It is important to note that if a cardiac setting has been chosen, the orientation marker on the screen will now be on the right-hand side. When holding the transducer in your hand, the orientation marker on the transducer should also face your right-hand side. By doing this, you are now orientated to the screen, and screen right is orientated to patient left. During this scan, we expect to be able to visualize the liver, the heart, including the right ventricle, the left ventricle, the right atrium, the left atrium, the mitral valve, the tricuspid valve, and the septum. Okay, so now we're ready to start scanning. The transducer is placed in the subxiphoid space in the transverse plane and orientated to the screen marker. Tilt the transducer anteriorly and apply pressure. Ask the patient to breathe in to better visualize the heart. The transducer may need to be tilted posteriorly during inspiration. Identify the right ventricle, left ventricle, right atrium, left atrium, tricuspid valve, mitral valve, and septum. Then tilt the transducer posteriorly and anteriorly to fully sweep through the heart to assess the pericardium for the presence of fluid. Consider the 3 F's: form, function, and fluid. Assess the overall size and shape of the heart. Consider the relative size of the right and left ventricles. The left ventricle should take up 2/3 the diameter of the overall heart. Consider the cardiac contractility. Is the heart hypo or hyperdynamic? Do the ventricles change in volume by approximately 50% during each contraction? Or is there very little volume change, or are they completely emptying with each contraction? Finally, assess the pericardial space for the presence of an anechoic collection, which would indicate a pericardial effusion. This completes the subxiphoid view of the heart.